to the word of Almighty Allah subhanahu wa ta'ala, which is the recitation from the glorious Quran. And to do that for us is Malam Abdullah Sulaiman within 3 minutes. Malam Abdullah Sulaiman, Bismillah. Malam Abdullah Sulaiman.
أعوذ بالله من الشيطان الرجيم بسم الله. يا أيها الذين آمنوا اتقوا الله حق تقاته ولا تموتن إلا وأنتم مسلمون واعتصموا بحبل الله جميعا ولا تفرقوا واذكروا نعمة الله عليكم إذ كنتم أعداء فألف بين قلوبكم فأصبحتم بنعمته إخوانا وكنتم على شفا حفرة من النار فأنقذكم منها كذلك يبين الله لكم آياته لعلكم تهتدون ولتكن منكم أمة يدعون إلى الخير ويأمرون بالمعروف وينهون عن المنكر وأولئك هم المفلحون ولا تكونوا كالذين تفرقوا واختلفوا من بعد ما جاءهم البينات وأولئك لهم عذاب عظيم يوم تبيض وجوه وتسود وجوه فأما الذين اسودت وجوههم أكفرتم بعد إيمانكم فذوقوا العذاب بما كنتم تكفرون وأما الذين بيضت وجوههم ففي رحمة الله هم فيها خالدون تلك آيات الله نتلوها عليك بالحق وما الله يريد ظلما للعالمين اللهم ارحمنا بالقرآن سهو
الحمد لله رب العالمين. صدق الله العظيم وبلغ رسوله الكريم ونحن على ذلك من الشاهدين والشاكرين. We pray that may Almighty Allah subhanahu wa ta'ala reward our brother who have recited the glorious Quran, and also every one of us that are listening appropriately. Pray that may Allah subhanahu wa ta'ala reward us and put it in a scale of our good deeds. Now we are blessed tonight. We have with us two great scholars who are going to discuss the triangle of silent killers with us. The main speaker is my good brother in person of, he is a consultant nephrologist and a clinical pharmacologist. He's also the head of dialysis center at Bagada General Hospital. He's no other person than Dr. Abdulwasi Husseiri. He is going to be the main speaker on the topic, which is stress, hypertension, and diabetics. Our second contributor, who is second speaker, is Dr. Abdullah Anyawali. He's also MBBS and he has done his MPhil and is now a PhD student in University of Texas, and he's specialized in public health. Inshallah, by the time we get there, we are going to call on you. So we are happy having the two of you today as our guest speaker, and we pray that may Allah subhanahu wa ta'ala will guide your tongue and guide your intuition so that you can give us the best of the best. So without much ado, I'm going to call on my good brother, Dr. Abdulwasi Husseiri, to present his talk within 40 minutes. Assalamu alaikum. Bismillah.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
Alhamdulillah Rabbil Alameen wa salatu wa salam ala ashrafil mursalin Sayyidina Muhammad sallallahu alaihi wasallam wa ala alihi wa sahbihi ajma'in. Alhamdulillah. We give thanks to Allah subhanahu wa ta'ala, the God of the words, the omnipotent and science God. We thank him, we adore him, we glorify Allah. We beseech him to shower his blessings on the noble soul of Rasulullah sallallahu alaihi wasallam, his household, his companion, and all of us that we are following the path of felicity after Yamal Kiyama. I'm indeed honored and grateful to the organizers of this program for the fee to invite me to talk on this important topic. And coinciding with the birth of Prophet Sallallahu Alaihi Wasallam. And one of the things that we should remind ourselves about is who Prophet Sallallahu is to us, our messenger, the one who guided us. Through him, we are guided to Islam. And talking about health is also some of the things that Prophet Sallallahu has encouraged us as Muslims. So it's really perfect that we've chosen today to talk about health issues. So without much ado, I will be discussing this topic termed stress, diabetes, and hypertension, the triangle of silent killer. And I will go through this. First of all, okay, sorry, is this moving? Yeah, so let's look at some learning objectives. At least at the end of today, you should be able to understand the link between stress, diabetes, and hypertension. Also identify certain risk factors and the warning signs of these conditions, meaning the hypertension, diabetes, and even stress. Explore how lifestyle choices can affect these conditions and recognize both long-term and short-term complications of unmanaged, stress, diabetes, and hypertension. And of course, how do we prevent and what are the management strategies, for these killer diseases? So I'll go through this outline, but we already see it. Before I move into the discussion proper, I want to talk about health. According to World Health Organization, health is defined as a state of complete physical, mental, and social well-being, and not just mere absence of disease or infirmity. What health means is a holistic approach to somebody's well-being. In fact, in newer terminology, they have even put economic well-being. So for the fact that somebody does not have headache, he doesn't have body pain, does not necessarily mean it's healthy. What about his mental health? What about his psychological health? What about his financial health? What about his physical health? All of these are what health means. As Muslims, why is it important for us to take care of our health? Like I mentioned, Rasulullah sallallahu alaihi wasallam, through whom Allah has guided us. He said in several hadiths of this about the importance of health, to us as Muslims, and of course to the generality of humankind. And we can't practice this Islam, the way it should be practiced, unless we are healthy. Okay, is it salah that you want to perform without physically being fit, or fasting that Allah has even said if you are sick, then you can, then you can even leave off the fast because you will not be able to do it well, or the Hajj. So tell me one of the ibadats that we will do well if we are not healthy. No. So that means being healthy, being strong, is compulsory for Muslim to be good Muslim in order to be able to worship Allah the way it should be worshipped. And the only purpose of our existence in this world is to worship Allah. And whatever will make that worshiping of Allah possible has also become compulsory. Being healthy is one of the reasons why, one of the ways we will be able to worship Allah well, and so it is important. Rasulullah said in one of the hadiths that there are two ni'mah, blessings of Allah, that Allah has bestowed on, mankind. But majority of us are heedless about it. That number one is al-ahsiya, good health and time. So we are not supposed to be negligent of this. So I may not need to go through the other hadiths. So there are too many of them, even in the Quran, that shows us the importance of being healthy. So today, we want to talk about silent killers. And specifically talk about stress, diabetes, hypertension. And why are these called silent killers? It's because of their subtle onset, but severe, devastating health consequences at the end of it. So they're like crippling. You will not know at the beginning. But when they come, you find out that they, deal a very serious blow to each individual. So each of these conditions tend to exacerbate or aggravate the other. And they form like a dangerous, vicious cycle. No one affecting the other, and of course affecting the other. So if you look at stress as a trigger, what does it do? Especially chronic stress. When you are in a stressful situation, there are certain hormones in the body that begin to, be secreted in a very high level. Talking about cortisol, adrenaline, noradrenaline, glucagon. All of these are hormones. And these hormones, they drive blood pressure high. As they are also, they try to resolve the pancreas and, release glucagon, which will also drive blood sugar high. And the combination of increased blood pressure, increased blood sugar, of course, definitely have, devastating effect on the heart. That is cardiovascular disease. In the other hand, when you are stressed, there is probably an issue of sleep. You may not be able to sleep. If you don't sleep well, or you sleep too much, that is the problem. You may be gaining weight, or you may be losing weight. And of course, the mental faculty of such individual is grossly impaired. So you can see that it's exciting. So stress, diabetes, and hypertension, they interact. Like I said, stress increases blood pressure, increases insulin resistance. Diabetes damages the blood vessel, causing both microvascular and macrovascular damages. They increase blood pressure and, of course, hypertension. And hypertension, on the other hand, also causing heart problem and making diabetes to be, difficult to control. You can see that they are all interwoven and almost like inseparable. But what is stress? If you want to define stress, stress means different things to different people, sincerely. Especially for, fathers now. School are resuming, children are resuming. You know what stress is? It's school fees. School fees. For commuters and transporters, if you ask them what is stress, they will tell you it's fuel scarcity or fuel price. And for a lot of people, different conditions, present itself, and that is what they know as stress. But what is the real definition? Stress is the state of mental and emotional strain or tension resulting from adverse or demanding circumstances. So you can say that it's a response to demand or challenges. And this response could be physical, it could be emotional, it could be mental. And stress could be acute stress or chronic stress. Acute, which is usually short term, and usually to an immediate stress. For instance, if there is a fire incident now, there will be kind of stressful action. But that is immediate. But if it's a prolonged one, like, situation that continues, like bereavement, like loss of job and all of that are chronic stress. So stress can easily give to unhealthy lifestyle, right? People who are in a stressful condition will likely be having unhealthy lifestyle. They will have to drink, smoke, sleep late, unable to sleep or sleep too much, unable to eat or eat too much, unhealthy lifestyle. And again, unhealthy lifestyle can result to stress. So, like I said, these are visual signs. And if you look at this diagram, this guy is stressed. And you see a lot of the things that can be like causes of stress and what stress can also, lead to. The same thing here, different, circumstances can, give rise to stress. So what are stressors? Stressors are things that can cause stress. They could be external or internal demands. Example of external stressors include work demand. When there's too much of work overload or financial pressure. Like I said, people who are in perpetual debt, before they finish paying one, another debt is accumulating. Or maybe issue of relationship, maybe between husband and wife, divorce, or, infidelity in the family. There could be any of those problems. But there are some that are internal, for instance, self-criticism, worthless, state of worthlessness, unrealistic expectation. If you set unrealistic goals for yourself, you will be in state of constant and perpetual stress. And again, just be worried about future. What am I going to do this time? What is going to happen there? What is it? Always trying to fix everything about the future, which you don't sometimes even have control over. What are the triggers for stress? It could be personal life events, like loved one divorce, like I mentioned, moving on from one place to the other, and loss of job, So all of this can be, personal life events. For instance, if the people who probably are staying in Surulere and maybe the cost of living and of course rent has gone so high, or the landlord gave them quick notice, and the next thing is to go and look for accommodation in Yanosesi or Yanoba, or Agbowa Mota, and he's working in Via. There was a friend of mine that, that history end. And he has to wake up 3 a.m. every day. Otherwise, he will be stuck in traffic. And he will have to leave his office in VI by 9 or 10. Otherwise, he will be trapped in traffic going to... You can see that on a daily basis. These are chronic stress, perpetual stress. Workload. If you're having 2 tight deadlines, before you finish one, another one's already there. Before you finish one, another one is already there. All about environmental stressors, like noise. Noise can actually be a serious issue. Pollution, unsafe living conditions. All about psychological stressors. Definitely anxiety, low self-esteem, fear of failure, and all of that. So what are the connections between stress and health condition? I've mentioned some. It could be mental health. When somebody is in a perpetual stressful situation, it can develop mental issue like anxiety, depression, burnout, or heart condition, like hypertension, diabetes, or risk of heart attacks. Diabetes, of course, we mentioned, even gastrointestinal, in which the person will just always be having abdominal issue problem, rumbling, constipation, indigestion, because it's constantly stressed. And sometimes it can even weaken immunity. So what are the signs of stress? It could be physical. So sometimes if it gives signs, but at the beginning, it may not even give any sign. In fact, the person may not even recognize those signs when they come. Because it's like general thing, headache, muscle pain, fatigue, you're always tired. Stomach upset, I've mentioned. These are physical. What about emotional? Individual who is stressed, will be maybe irritable. Any small thing it will spark. Any small thing it will shout. Any small thing, And in fact, if it's a father and immediately is coming back from work, everybody will disappear. Because if care is not taken, you can that's it. Is meaning the person is undergoing strain. What about mood swing? Today is happy, tomorrow is sad. Answer head depression. Behavioral changes like loss of appetite, unable to eat, or sometimes even eating too much. That's voracious appetite. It may be because of stress, sleep disturbance, insomnia, or somnolence, meaning it's sleeping too much, or sometimes you cannot sleep. And of course, withdrawn from the society. Of course, all of this, how do we reduce stress? Diet. Please eat good diet, fruit, vegetable, whole grains, all of this. We adequate sleep, find time to sleep, rest well, at least between 4 to 6 hours a day is important. Time management. Don't set unrealistic goal for yourself. Things that you cannot prioritize things. Take them one after the other. Know your limit. Don't take stimulants, coffee, caffeine, all of those things. Cola. Some people are so addicted to even cola, and cola drinks. So all of these are things. How do we manage stress? Of course, we have physical techniques like exercise. We have, relaxation techniques, even ordinary breathing in and out, and calm the person down. What about emotional techniques? Mindful meditation, recitation of the Quran. Not only recitation, you meditate, reflect upon what you have read. You can't, you should understand that you cannot control everything. Just do your best. Whatever we meet you, whatever is destined to escape, you will not meet you. In the Quran, Allah says, huwa maulana fa'ala Allahi falyatawakkalul mu'minun kullu la yusibana illa ma kataba Allahu lana huwa maulana wa 'ala Allahi falyatawakkalul mu'minun. Said nothing will befall us except that which Allah has already ordained, because Allah is our Mawla, is our protector. So put your trust in Allah. Do your best and leave the rest. Put your trust. If you want to control everything, you will be under perpetual stress. So that is stress and how it is linked to hypertension. Because of the time, what is hypertension? Definitely, hypertension is the most common non-communicable disease all over the world. It's more than 1.3 billion people are hypertensive. And hypertension does not respect any age or gender. It doesn't respect any ethnicity. Everybody is involved, and it's increasing globally. It is even said that 1 in every 5 female will be hypertensive in their lifetime, and 1 in every 4 male will be hypertensive in their lifetime. So what are the causes of hypertension? Well, it doesn't have a specific cause, because hypertension are 2 types. We have what we call primary or essential hypertension, and we have the secondary. The primary, which is about 95% of type of hypertension, does not really have a specific many factors, and that is what we talk about risk factors. But these risk factors are also divided into 2. There are some we call modifiable risk factors, and some are non-modifiable. Modifiable risk factors are things you can do something about, and not modifiable, you cannot really do much about it. For instance, age. It is known that increase in age is a risk factor for developing hypertension. Are we not going to grow old again? You cannot stop you being growing old. So what about gender? If you're a female or male, because it's been known that male gender are risk factor for hypertension. Are you going to change your gender? Even if you do, once you get to female also gets to age 55, then the risk becomes the same. What about hereditary? There are certain personalities, type A personalities that are risk, of hypertension, or by family history. Those who already have family who are hypertensive, they are at risk of developing hypertension. There's nothing you can do about that. Ethnicity, they said, black race, we have more, prevalence of hypertension, and even the type of hypertension that occur in black race is usually very severe form. But the modifiable risk factor are things we can do something about, like diabetes. You can try to prevent it. Obesity, being too overweight. Physical inactivity, not just doing anything, just sitting down. These are things that will, predispose individual to high cholesterol, cigarette smoking, alcohol, unhealthy diet. All of these are modifiable risk factor, meaning that you can do something about them, and you should do something about them so that you can either prevent or mitigate the effect of the hypertension. So what are the signs and symptoms? Usually asymptomatic. What that means is that it may not even give any sign and symptom. And that is why they are called silent killer. You see, I will take our time a bit because I always tell this story. There was a time I was at the clinic. But in general hospital, there's what we call GOP, general outpatient clinic. So a man came to general outpatient clinic, not to my clinic. Maybe just say he's feeling like he has malaria. So he came. But routine is that they must check blood pressure, vital signs, and all all patients before they were able to see the doctor. So the nurses did, and they found out that this young man, about 32 years age, had a very, very high blood pressure. So they were shocked. They used different machines to check. They were still getting very high. So they told him, okay, we will go and we'll take you to a specialist. Your blood pressure is just too high. So when they came they now brought him to my own clinic, renal clinic. And the man was just already protesting. Why are they disturbing me? He doesn't have any problem. Let him just write malaria drug for him. We want to go home. That which blood pressure he has ever been hypertensive in his life. His blood pressure was ever. He want to go back home. They should just leave him alone. So I calmed him down. Okay, calm down. Let us check. In my mind, because they told me the blood pressure, you know what they said? They said the man has blood pressure systolic of 250 and diastolic of 180. In my mind, I said, no. I didn't tell them that maybe they didn't do it well. 250 over 180. This man that is talking to all of us and all of that. So I didn't believe. So I asked him to sit down. He sat down for some time, so to rest. So and I said, okay, please give me speed. Let me do it myself. I requested for mercury in glass sphygmomanometer like the one is shown in the picture, because that is a bit more accurate, unlike the digital. The digital took be accurate, but it can. So, to my surprise, in fact, I've never seen anything like that in my life. And that is why every time I talk about hypertension, you will see me talk about this incident. And since that time, I've never seen anything like that. When I checked this guy's blood pressure and I started inflating, the highest level for this mercury in glass is 300. I'm telling you, this guy's blood pressure is above 300. Because at 300, the conductors can still be heard loudly. Meaning that it is even more than 300, the highest OTJASK. And then the diastolic that they've got 180, I got 210. So this is 300 or above 300 systolic over 210 diastolic. I have never seen anything like that in my life before that time. And even after that, I've never seen anything like that. This man said there's nothing wrong with him. I said, you cannot go. We're going to admit it. He didn't accept. He didn't accept. So he went to. So what happened after? Maybe that will be a story of another time. Now, this thing is a silent killer. You see some people, they just drop dead. Some people may be, giving lecture, they may be doing party, they just say they drop dead because the blood pressure may have been so high without them knowing. And of course, if the blood pressure is so high, it can rupture the cerebral vessel, that is the blood vessels of the brain, and it will bleed into the brain, and that is instant death. Please don't fight anybody, especially this time, because you don't know what they have. Even ordinary arguments can kill people because of what they are carrying and they do not know. So it's a silent killer. Sorry for taking our time here, because this is the crux of the matter. It doesn't give signs and symptoms in most cases, so you will not know. People don't know. And sometimes when they give this vague, like headache, who doesn't have headache? Like tiredness, like dizziness, who doesn't have that? It's not specific. By the time it's giving specific signs and symptoms, the complication are setting, and that is bad. Okay, what are the complications? Heart attack, stroke, kidney failure, heart failure. In fact, kidney failure, I'm a nephrologist. Kidney failure, let us not even talk about that. When all diseases are bad, but kidney failure, maybe because God. It will impoverish the family, everybody, because you do dialysis. How much is dialysis now? Average is about, 50,000. Let me just, lowest. An individual will have to do that 3 times a week. That's 150,000 in a week, apart from other drugs. How much is that in a month? 450,000 in a month, 450,000 in a month to do that is to keep alive. It doesn't even cure the disease. How much money can somebody have? I don't like to talk about the body of chronic kidney disease. Maybe in another time. So how do you diagnose hypertension? Of course, it's easy. Just do the blood pressure with sphygmomanometer, and it will show whether it's high or not. But other tests that we do, like analysis, blood test, chest X-rays, it's just to know if there are complications. But blood pressure diagnosis can be done on the spot, especially if so. All of these are things that way. What about, there are some misconceptions about blood pressure or hypertension. Some people say, I'm young. I know, how can you talk about hypertension? How old am I? I'm just 20, I'm just 30. But it doesn't respect any age. I've just mentioned to you the young man that had the highest blood pressure that I've ever experienced in my life. Young man. Some people say, I'm not thinking now. What am I thinking? Why should I have blood pressure? It's not about thinking. Look at the different risk factors I've mentioned, including stress. Is it curable? Not necessarily, but it's manageable. Once we take care of it, it will not lead to complications. Complication is a problem. High blood pressure itself may not even give any signs and symptoms, may not affect you. And that's why people don't know. So if you can keep it that way by managing it, then it's okay. What about duration of treatment? So a lot of patients ask me, for how long am I going to be on medication if they have started? I tell them it's lifetime. Yes, because it's a chronic disease. It doesn't go away. What is important is that control it so that it doesn't lead to. How about diabetes? Diabetes is a chronic hyperglycemic state when there is high blood sugar as a result of insulin lack or inefficiency of the insulin. So insulin is secreted by the organ we are looking at here, called the pancreas. So when that insulin that's supposed to control the blood sugar is inefficient or insufficient, then there will be high blood sugar, hyperglycemia, or diabetes. It's also increasing every day. And unfortunately, most of the death as a result of diabetes occur in middle or low income country like ours, Nigeria. And of course, it's associated with high morbidity and mortality. And a lot of issues like sudden death, blindness, amputation, stroke, and frequent hospitalization. So we have different types: primary diabetes, we have type 1, type 2, gestational diabetes, the one in pregnancy, and of course the intermediate. And then we have the secondary form as a result of other diseases. I'm not going to bother us about type 1, but this type 1 we used to call it insulin-dependent diabetes, usually more of childhood. And of course, type 2 is more of adult, this. Gestational, meaning pregnancy can induce diabetes, usually between 24 to 28 weeks of gestation. in pregnant women. So causes like hypertension could be genetic, could be environmental, like diet, obesity, inactivity, stress, pregnancy, like I've said. Usually people with age 45, but doesn't mean it cannot occur in children or in childhood. Of course, those who have family history, microsomy baby, blood pressure, obesity, all of these things, they are cycle. They just become form visual cycle, and you continue to have them like that and like that. But for diabetes, a bit different because that one can give signs. Hypertension may not even give any. So diabetes may not, but it may. When it gives signs, it could be polyuria, meaning excessive urination, polydipsia, meaning excessive drinking of water, always thirsty, polyphagia, meaning excessive eating, and weight loss. So any echo mama jẹun láti máa bó ṣe jẹun ló máa rù. Wọ́n lè sọ pé àwọn ayé ló ń ṣe. It's not ayé o. It's diabetes o. Weakness, fatigue, recurrent boil, recurrent infection, prolonged wound healing. Of course, cataract, blindness, microscopic baby. When somebody is giving birth to a very big baby, sometimes tingling sensation, numbness in the leg, on the hand. It may be diabetes, And of course, can also present as sudden death, like we have mentioned. It has a lot of complications that many of them have mentioned. Some of these are complications. How do we diagnose it? It's not difficult as well, and WHO says that once it's reached a level, whether it's fasting blood sugar or 2 hours postprandial or impaired fasting glycemia, all of these we can make diagnosis. So when we do urinalysis, cholesterol level, blood electrolytes, kidney function, is for us to know whether there are already complications, And of course, how do we manage? Like I said, we want to reduce symptoms, we want to promote well-being, we want to prevent, complications, of course, delay onset of progression to long-term complications. So, and in management, it could be drug use, and it may not be drug use. For non-drug management, nutrition, very important. That's why we say, no, this, you can't take sugar or anything that sugar has been added. You must exercise, you must continue to monitor your blood sugar. The person requires education on how to manage it. And you can use drug. And when it is drug, there are different ones. For diet, of course, you have to ensure weight control, nutritional requirements. All of these are very important. Drugs, there are so many. The essence of this topic is not to tell us about all the drugs, but there are many drugs that are used. And of course, sometimes you may have to do replacement, which is insulin. Insulin is lacking, you may have to give insulin, especially in type 1 diabetes that we call, insulin-dependent diabetes mellitus there, because it's usually insulin that you can only use. And there are different sides this insulin can be given. And sometimes you may have to do pancreatic transplantation, because the pancreas is the organ that is, disease that is not making. So how do you monitor? Regular blood glucose monitoring. Of course, with food care, because it can cause diabetic foot. Many people got amputation because they didn't care for their feet. Hygiene, lifestyle, target control. Now, there's also certain misconception about diabetes. Some people will say sugar causes diabetes. No, sugar don't cause diabetes, but can aggravate it. All right. Once diabetes is there, you can't take sugar or anything sugar has been added. But if someone has a very strong family history, please let the person to start to reduce sugar intake, even when it's not yet diabetic, because it already has the risk factor very high. Diabetes is also curable, not necessary. It's a chronic disease, but it's manageable, and it's preventable. Some people will say if you take bitter leaf or something very bitter, maybe yo-yo bitter or something, the diabetes will go or you will not have diabetes. Well, there has not been any scientific basis for this. It is not like acid and base that you are saying you want to neutralize them by adding acid to base. No. So for the fact that diabetes is a problem of high blood sugar, which is sweet, does not mean that if you put something that is bitter, you will be able to. What about all this other query cure? Well, they may work, they may not work. herbal tea, Chinese drug. Some people will say there is a vibrator that once they stand on it, diabetes will go. Well, I'm not sure about that. And duration of treatment too is usually lifelong, because so all this we need to now know how to maintain well-being. There are 4 stages of prevention. There are what we call primordial, primary, secondary, and tertiary. See, primordial prevention is even before we are giving birth to, or before we give birth to our own children. Once you start doing, for instance, diet, you take less salt diet, you take vegetable, fruit, you avoid alcohol, you avoid smoking, all those lifestyle. You are doing it. It will rub off on the baby, on your unborn baby. So that is primordial, before that baby is born. Now, primary prevention is now, the baby is born now. It too is now in the family where you're taking low salt, you eat moderately, you eat balanced diet, it's already, at that point, it doesn't have hypertension, it doesn't have diabetes, so you are preventing it coming. And that is very, very good level of prevention. Now, if that is not done, and the person now becomes hypertensive, then you start secondary prevention, meaning that at that point, you will still continue to eat less salt, don't eat too much sugar, fat should be reduced, you should do exercise. He already has hypertension, but you want to prevent that hypertension from leading to stroke, from leading to kidney disease, from leading to which are the complications. So it's secondary prevention. And then tertiary prevention is that when stroke now occurs, you still have to prevent another recurrence. So that is the all the mode of prevention. So when you talk about healthy diet, please eat moderately. Prophet Sallallahu has already told us that we should divide our tummy into 4: 1 for food, 1 for drink, and the other one to breathe well. That is moderacy. Don't eat too much of unsaturated fat. Avoid frying things every time. Don't stop. Avoid eating in the eateries and joy, Mr. Big, Uncle Bigs, and all of those things that they are always selling salt, fat, and sugar to us. Because without it, it will not be sweet. They will say it's not sweet. You too, you will say it's not sweet. You won't buy it. But these are the things that are increasing the risk for diabetes, and even stressful condition. Reduce protein diet. And then when we talk about salt, it's not only salt and its cousins and sisters like Maggi, Ajinomoto, Royco, all of those ones. They are monosodium glutamate, sodium chloride. They are, sodium, Okay, so you need to reduce weight. Ensure that your BMI is not more than 25 kg per meter square at any given point in time. Once you wait and you say, please cut down on the weight, do regular exercise, 30 minutes every day, sweated exercise, at least 6 days per week. The benefit of exercise cannot be overemphasized. There are so many, I'm not going to be able to read all of them to us here. Please avoid all these things. Cut down on or you have all processed food. Please, stop alcohol, stop cigarette, stop caffeine. If anybody engages in such, as Muslims, we are even not meant to take alcohol or even cigarettes. Eat more of fruit, vegetables. It's good. I've not spoken. Okay, I've mentioned all of that. Don't abuse herbal concoction or even conventional drug, because they can also be cause of healthy situation. So regular check, diabetic kidney, all of this. In conclusion, the triangle of stress, diabetes, hypertension is interlinked, and there are dire consequences and poor outcome if they are neglected. They are manageable and even preventable. We've mentioned this. Prevention is key, and it's usually through early detection, lifestyle adjustment, and medical care. Remember, prevention is a way, way, way better than cure. Jazakallah khairan. Wassalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullahi ta'ala wa barakatuh. Jazakumullahu khairan. We really appreciate your discourse, and you help us to manage your time, despite the fact that you have a lot of things to say, and we really appreciate your discourse. May Allah subhanahu wa ta'ala reward you abundantly for this eye-opener. Without much time, I would like to go to the second speaker, who will be also discussing within the range of 5 to 10 minutes, Dr. Abdullahi Anyawali, from the University of Texas. Bismillah.
Bismillahirrahmanirrahim. I don't know if I can share my slide.
You can.
Okay, just.
Okay, while you are doing that, let me quickly use the opportunity to recognize our mother of the day, and that is no other person than Ajia Shakira Abdulaziz Adeniran. Sorry, ma, it's an oversight that I didn't introduce you at the beginning of the program. I'm very, very sorry for that. Please, can you say Teslim to the house if you're around?
Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh. It's interesting to hear your voice. Secondly, the chairperson of today's occasion is also one of our mother, in person of Ajia Rashida Hamad Zavador. Please say Teslim to the house. Wa alaikum assalam wa rahmatullahi wa barakatuh. So, Dr. Abdullah, please go ahead.
Okay, Bismillahirrahmanirrahim. Thank you very much. I won't take much of our time because my Oga, my mentor, my Alpha, he's my everything, so yeah, he wanted so so I'll be on Basmano Watala, Colon Jekuji wa Jubia, she saw you know, Colon Made ki our no, he silent killer, Kuma. A lè sọ pé kò ní ṣẹlẹ̀ kọ́lọ́run jẹ́ kí a rí manage kọ́lọ́run jẹ́ kí a rí handle ní a máa gbàdúrà because guys sọ gbogbo àwọn tó ti sọ́nu lecture yẹn náà there are things that tá a lè control wà àwọn tá a lè control wà so just because a lè control àwọn nǹkan so kò sọ pé kò ní ṣẹlẹ̀ so nǹkan yẹn ó lè ṣẹlẹ̀ so mi ní waste time lórí àwọn slide mi màá kàn so àwọn little things ni mi ní waste time lórí gbogbo overview by like just talking about hypertension those things like that so wọ́n ti sọ most of gbogbo ẹ̀ àti risk factor náà so àwọn ti sọ gbogbo àwọn ìyẹn symptoms náà gbogbo ẹ̀ lè wọ́n ti kà fún wa so actually wọ́n ṣàlàyé bọ́n ń diagnose ẹ̀ fún wa so wọ́n ṣàlàyé SFIG yìí fún wa so maybe if some of us want to need maybe kí n kàn sọ díẹ̀ ń pa ẹ̀ so gẹ́gẹ́ mọ̀ pé scenario yẹn tó ṣàlàyé fún wa nínú gbàtàn ṣe lecture wọ́n lẹ́nu yẹn gbàtà àwọn ẹ̀kọ́ kọ́ ṣe blood pressure ẹ̀ ó wà very high. But just because one share your very high, for me, one side of penny hypertension. So, I know so okay. The doctor, the consultant later said that the patient should wait in the clinics, and after the patient has waited, they have to do it again. So it means that for you to say somebody have hypertension, you just don't do one single check. You have to do it again and again for that day, so as to be sure that the value is consistently high to be able to say the person has the hypertension. You can see from my own procedure how to go about saying that somebody actually has it. So that's how to handle hypertension. But how can we tackle it? There are so many people that can help, in managing or in controlling hypertension. The government and policymaker can do their own. Because me, I'm looking at it more in terms of a public health perspective. So that's my own angle a bit. So the government, one of those things the government can do for us is to make hospital available, to make health worker available in the hospital that can, when we go there, they'll be able to see us and tell us we have this and tell us what to do. Policymaker to know, have to like telling the government to make sure, hospitals are available. Even if there's no big hospital, they can have, we have primary health center. Or even if there's no primary health center, you can even have kiosks that the government, people that can do it for us. Just because maybe one way or the other, the government is not doing their job. That's why we see all these people all around our streets. We'll see them carrying swig up and down, telling us this miracle drug and things like that. So all these people are not, qualified to do some of these things. And just because government and policymakers are failing, that's why we have all of these people all around. So health workers too have the role to play in making sure that people are not so hypertensive. One of those things they could do is to organize health education, like educating our people on what to do, what to stay away from. Like the one we are having today as well now is one of those things our health worker can be doing for us so that they will inform us, they will give us the necessary and genuine information that can help us to be saved, that can help us to manage some of these things adequately. So academic research community, even if you are a professor, you're not a doctor, you are researching, when you are doing a lot of research and telling us that, not be putting so much thought, so you don't keep it in your journals, you try and communicate it to the people too. Like most of researchers now, they just want to publish. Most of them, they don't bother about saying, yeah, let's communicate to the people that will need it. So communicating some of these things to people that need it can also help. Civil society as well, like the NGOs, they can have campaigns on reducing hypertension, campaign on reducing diabetes. These are some of those things all these people can do. Private sector too can help. Like we all have private company all around the country. So they too, they can make if they can't even provide health insurance, one of those things they could do annual check. Okay, you people that are working in our place, come and check your blood pressure, come and check your sugar, come and check everything. Those are one of those ways that you could tackle. And then families and individual, like the person that is affected by hypertension, the person have to take all those health worker advice, go to the hospital, go for checkups, trust hospital to follow advice, and trust hospital to also use the drug as well. Family members who can help in ensuring that the person also, follow the advice, help them to cook. It's not sometimes is difficult for a single person to manage hypertension just because when they are cooking, they want to put less salt. And then everybody in the family want to put plenty salt in the food. So we also have to the family also have to put the people that have hypertension into consideration when cooking. It's not that we'll now be separating their food, and those kind of things make managing hypertension stigmatizing, and the people will not want to follow the education and reduce of salt and things like that. So let me quickly go to diabetes. So they talk about diabetes as well. I will not talk about this one, the types and the like. So what can be changed, what cannot be changed. So how it can be, diagnosed too has been mentioned to us. And then how to tackle it the same way, like I've said, with hypertension, it could be managed as well. For stress, it has been defined for us, and we have so many symptoms. And then stress affects all parts of our body. So that's one thing we need to know. It's not only maybe the mental one. It could affect, your digestion, your hypertension, your respiration, your breathing. It could affect all parts of the body. So how to manage? They've told us how to manage all of them too. I'm just showing this one. Now, let me now, round off with this small part. How is all of these three things connected? Now, I'll start from stress. Like they told us that stress could be acute or it will be chronic. So in this kind of case now, most of us will go through chronic stress in our daily life. Like they've mentioned, the typical scenario of stress that we go through in Lagos, that, from the hold up we have all around our city, shouting onto one another. And it's not only that. Even there are some of us that are doing unskilled jobs. People that are doing unskilled jobs because they take so many instructions from the boss. In as much as the job is unskilled, it's going to give them a lot of stress. And also take a lot of instructions. That's going to be additional stress. And most of the time, people that are doing unskilled job will not have time for holiday and things like that. But the boss, the big boss in all those firms might have time for holiday and things like that. So if somebody is undergoing constant stress, like you are going through stress every single day, what is going to happen is this: the cortisol level in your blood will be very, very high. Maybe, I don't know, maybe I'm going to pathogen, maybe I'm going through, maybe I'm going through deep scientifically. So what will happen is that if you are going through a lot of stress, the cortisol level is going to high. And when your cortisol level high, it's going to cause a lot of problem, like we have seen in this picture. This picture we see here is ACTH, adrenocorticotrophic hormone. It's the one that's released by the brain when we undergo stress. And that will stimulate the kidney to produce cortisol. And we can see in this picture. So when cortisol is produced, you can see heart rate increase, which is linked to hypertension, that we say they are triangles that are connected. And also, if your cortisol is high, now what's going to happen to the liver? The liver is where our glucose is controlled. So what's going to happen to the liver is that glycogen is going to be converted to glucose. So you now have a lot of glucose in your blood. So that's when somebody now have hyperglycemia, high sugar in the blood, which can lead to what? Diabetes mellitus. So we can see that when the level of stress we go through is becoming constant every day. It's becoming constant for like 1 year, 6 months, and the likes. The cortisol level will be high. And when the cortisol level is high, heart rate will go up. When the heart rate is go up, the blood pressure will be high, and the person will have hypertension. And also, the liver is going to undergo a lot of stress. When the liver is undergoing stress, glucose become converted to glycogen, become converted to glucose. And the glucose is seen there in our blood and it becomes so high. So that's how they are connected. So maybe if we don't take so much out of my own talk, the little we can take out is that when your stress level is high, consistently, chronically, that is continuously, not just that somebody like maybe you are the head teacher of the school now, You just say a little stress because the kid are making noise. You just say, keep quiet. That one is not stress. So, like, like I've explained, someone that is unskilled labor, like someone that's like a laborer, that's to like use all his power to do all of his job. So it's undergoing so much stress. And then with stress of the road too, the person cannot stop working. The person have to work. So those kind of people undergo a lot of stress. So it's not only that. Those of us who drive in the whole city of Lagos. Now I know some people that they are staying in the mainland and they work in the island. We can't blame ourselves for that, but we still have to do it. The only thing we just have to do is we just need to try as much as possible to follow some of those, sleeping hour, rest, good food, exercise, and the likes. So if we don't take anything, let us just remember what connects stress, hypertension, and diabetes is cortisol. So when the cortisol level is high, every other thing spiral up, every other thing goes up. I will stop here because of time, so that when we have questions, we can ask questions and answer. Subhanaka Allahumma bihamdik, ashhadu an la ilaha illa anta astaghfiruka wa atubu ilayk. Subhana rabbika rabbil izzati amma yasifun. Salamun alal mursalin walhamdulillahi rabbil alamin.
Jazakumullah khairan, Dr. Abdullahi, for the short presentation. May Allah reward you for the insight that you have added. Because of time, we are running out of time now. I want to give us the opportunity to ask questions. Please kindly indicate by raising up your hand so that I can call you apparently. Okay, Dr. Malam Musa Shomi, please go ahead with your question.
Assalamu alaikum warahmatullahi wabarakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh.
My question goes to Dr. Busari. During his presentation, he said at least in a day, we need between 4 to 6 hours of sleep. And what I know before now is that at least a day, we should have like at least 8 hours of sleep. So I want to be sure, is 4 hours enough in a day? Thank you.
Okay. I'll also call on Data Job Ninja. I think that is Malam Maru. Please go ahead with your question.
Yeah. So my question is this, what are the prophetic medicines to curb all these diseases, like maybe the hypertension, stress? Are there any prophetic medicine that are available to each individual?
Okay, thank you so much. Well, Fatai Laide Rufai, please go ahead with your question.
Okay. My question is for someone, let's say, for example, okay, I married, but fortunately I lost the wife. So the person I lost was very good, but the new one I later married was just like the opposite of the first one. So I now believe that everything is Allah. But sometimes when I sit lonely myself, maybe at the place of work, I will be thinking some kind of the character of the second one. Sometimes I will just be digesting it. I will now believe is Allah. So in such a situation like that, how can somebody manage that instant to the level that sometimes when I'm working, I will think it. Then when I realize I'm thinking something, I will now cope with that instance and just go. So how can somebody stop that particular thing? Thank you. That's my question.
Okay, I think I will add to the question so that it will be the last one, and it also goes to Dr. Useri, or any of the speakers can actually advise. In Nigeria now, the situation of economic is so critical that, and you mentioned something about financial stress, and we know stress is also a risk factor to hypertension and diabetes. So how do you think we can manage this financial stress? Because a lot of people want, especially the family people, the breadwinners, it can be male, it can be female sometimes, they want to do more and more and more in order for them to be able to earn more and to take their family. So please, I think we need an advice with that regard. So Dr. Useri, please, a response.
Okay, so Jazakallah khairan for the questions. So about the sleep, yes, 4 to 6 hours, it's sufficient. Okay, that is, I think, the minimum. All right. It doesn't mean that if you have opportunity to sleep 8 hours, that you shouldn't, and it doesn't mean that if it is 4 hours you are able to sleep, that you will not be okay. All right. 4 hours means you sleep 12, you wake up 4. That's what it means. That's the minimum. Okay? If you have slept 4 hours, 12 to 4, you will be refreshed. But that's the minimum. All right? Because certain conditions may require that you you shorten, your sleep. Okay, so but so what I'm saying is that is the least. All right, it's a range, but it's okay. On the second question, can you remind me of the second question? I didn't write them down.
Oh, okay. I think
Prophetic medicine.
oh yeah,
Prophetic medicine.
yeah, there are quite a number of prophetic medicine that can be used, But like I said, let us also use them in addition with our conventional medicine. All right, it's additive. Just like if we are using one medicine, they will say add this to it if it's not controlling. They can also say add this to it and like that. Do you get? So for example, Abatu Sauda, which is black seed oil, the Gela sativa, it has a good effect on diabetes. I've made a lot of research on it. I'm a pharmacologist as well, and yeah, it's very promising. All right. Camel milk. Camel milk too is good for hypertension. Right? These are things you will see in Tibu Nabawi. That is prophetic medicine book of Imam Ibn Taymiyyah. I think it was Ibn Taymiyyah. That compiled Tibu Nabawi. You find them there, right? But like I said, it's not as if that's the only thing you can use. You can, combine them and of course with lifestyle modification. It depends on the level of hypertension or level of diabetes and so on and so forth. So, but they are shown to also be very effective in certain situations. What is the third question?
Somebody that got married to the first wife and the first wife died.
Yes, see, number one, it was obvious that what the person is suffering from is one of the causes of stress, unmet targets, unrealistic goal. Two people cannot be the same. Two people cannot be the same. So you don't expect that the first wife will be exactly like the second wife or the third wife, but even if you didn't divorce and you have to marry 2 wives or 3 wives or 4, at least like example, they will not behave in the same way. What you should do is that what are the strong points or what we can call strengths of this second wife, right? So you dwell more on those strengths and ignore, if to say, some of those negative, because even you, the husband, you're not perfect. So if you say you are managing her, maybe she too is managing you. So sometimes, no, it's true. You just give yourself strength and you will go and marry another person. So don't start looking at your first wife. She's gone. And understand it can be a bit difficult, but that is the way you have to manage it. There are things that people will do that will require divorce. If those things are not there, that okay, these are things that require divorce. There are certain things that's in Islam, and the divorce is hated by Allah subhanahu wa ta'ala, but it's permitted. So if your second wife has not done anything that will require divorce, so meaning that you are not divorcing her, you have to like what you see. If you don't see what you like, that is the way to manage stress. Oga, I'll not tell you. Now, any other question? Or then the fourth question?
The fourth question, financial crisis. How could we manage it, especially with the economic situation in Nigeria?
Wallahi is the biggest stressor now. That financial crisis is the biggest stressor, if I would not lie to you. So, but there's nothing that Islam has not given us solution. Even the situation we find ourselves. A lot of this situation is man-made, all right? It's man-made, so we cause it. So we should, first of all, repent to Allah subhanahu wa ta'ala and mend our ways as individuals, because it starts with you and I. That is the first thing. And we keep, doing a lot of istighfar, all right? So, because Allah says, if you, seek istighfar, Allah is going to bring risk for you. And don't think about the Nigerian general problem. Think about your own self. Allah can provide for you with that measure. Get release that. Forget whatever is happening in every, even with the way that is for you. So what I'm saying is, color sharp is for you. Now, but you have to cut your coat according to your cloth, not your size. Not your size, according to your clothes. All right? So, I want no me tell you adjustment. Right? It's part of it. We should adjust. Some things we don't really need them. A lot of time it was maybe wasteful. So we cut on those wasteful spending, unnecessary things that are absolutely necessary. That's what we should do. You know, and like I said, don't set on limit me on realistic target for yourself. You know, afford, you know, and you'll be fine. But we need a lot of introspection.
Dr. Abdullah, do you have any addition?
Well,
Dr. Abdullah,
mi ò ní addition púpọ̀. Mo post kankan pé àwọn ní pé honey náà is multipurpose. Honey, like àtàbá ẹlòmíì tó wá fi pé òun ní diabetes, tó wá fi pé òun lè lo sugar, wọ́n lè máa lo honey. So honey too could help. So honey too is a prophetic medicine. So àwọn kan náà sọ pé garlic náà, garlic dá fún anti-lipid, like fún cholesterol level tó bá lọ sókè, ṣùgbọ́n nǹkan bẹ́ẹ̀ wọ́n ní garlic náà dá fún nǹkan bẹ́ẹ̀. So those are what the professor has recommended time immemorial that science are trying to find now at this point in time. So it's in my console, DNA.
Okay, Jazakumullah khairan. Now I'm seeing Dr. Yusuf Idris Garuba's hands up, and we want to honor it. Please go ahead with your question, and I think that should be the final question for the day. Please go ahead, Dr. Yusuf Idris Garuba. Dr. Yusuf, are you there? Okay. If you are not there, so we can quickly look at some of the information for today.
Hello. Can you hear me?
Hello. Okay, go ahead with your question.
Hello.
Sorry, if you can change your position, the network is not good. We can't hear you.
Oh, okay. Can you hear me now?
I think it's better now.
Okay. I said thank you very much, Jazakumullah khairan, for this very educative lecture. My question, hypertension, for those that knows as hypertensive, is there any sign for the stroke? Because I have an aged mother which is already hypertensive. So we are trying to manage, but she always complains her leg, her hand paining her, the veins are paining her. Could that be a sign of stroke? Thank you very much.
Okay. I'm welcome. Okay. Dr. Duasi, please go ahead. Did you hear the question? Dr. Abdulwasi. Dr. Abdulwasi Buseri.
Oh, sorry, I didn't realize that I was already muted. Okay. Yes, I had a question, although it wasn't so clear, but let me assume that what the questioner is asking is that there's an aged mother who is already hypertensive and sometimes complaining about pain in her hand or leg or something. That is it a sign of stroke? Well, that's not a sign of stroke. That's not a sign of pain. No. Stroke doesn't usually come with pain. Right? You know, age, comes with a lot of things, including osteoarthritis. So it's not impossible for elderly people to have body pain generally. Maybe in the joint, maybe. But stroke, if it is stroke, it is weakness of one side of the body. That's the way it presents usually. And it's usually sudden. Okay? Sudden. And it can also affect the face, one side of the face, and the speech of the person. And usually sudden. So It's only when it's occur like that we can start suspecting stroke. But if the person is complaining of leg pain, hand pain, it may be pain which is usually, you know, unexpected for. But many of these may not even require medicine or tablets. It may be balm, you know, just help them rub it. Sometimes you can help them move their hand, you know, do some set of small exercise for them, and they will be relieved. It's not all the time that we need to take, drugs. But for the blood pressure, if the mama is already using blood pressure medicine and it's well controlled, I don't think that's there is no problem, right? There's no problem. It's all qualified.
Jazakumullah khairan. Thank you so much. We really appreciate and we pray that may Allah reward you abundantly for the time you have spent to educate us on these issues. Likewise, Dr. Abdullah, we pray that may Allah subhanahu wa ta'ala reward you abundantly, and every one of us who have sacrificed our time to be part of our participants, the audience for today. May Allah reward you each and every one of us abundantly. The information we have for us is that next monthly forum is on prophetic medicine by Dr. Tijani. I think it's going to be a continuation of his last lecture. So that's the information. We want you to join us next month. Invite and other informations will be released and will be communicated to each and every one of us. Now I want to call one of our stars in the house to give us the vote of thanks, and that's no other person than Malam Musa Shoumi within 2 minutes. Bismillah, sir.
Alhamdulillah Rabbil Alameen. Praises are due to Allah. We appreciate him for making this a webinar a success. Equally, we sincerely say Jazakumullah khairan to doctors, Dr. Busari and Dr. Anyowale. May you both be rewarded with paradise for the knowledge you've shared with us today. We also appreciate the participants. We feel honored with your attendance. Thank you so much. Jazakumullah khairan.
With this, I think we'll come to the end of today's episode. And inshallah, we pray that may Allah preserve our soul to witness more of these in our lives and being able to continue to support this forum and this gathering so that more people will benefit from it. And please invite others too to join, irrespective of where they are. This is a global forum. You can be anywhere in the world and still join us. Pray that may Allah subhanahu wa ta'ala reward each and every one of us abundantly. سبحانك اللهم وبحمدك نشهد أن لا إله إلا أنت ونستغفرك ونتوب إليك سبحان ربك رب العزة عما يصفون والسلام على المرسلين والحمد لله رب العالمين جزاكم الله خيرا.
Jazakallah khairan for the invitation. My brother, Dr. Ayowale, how are you?
Alhamdulillah, sir. Thank you, sir.
Thank you so much. Yeah, really appreciate that.